The Kenya Medical Practitioners, Pharmacists and Dentists Union-KMPDU has opposed implementation of the newly enacted Social Health Insurance Fund Act. The union says the act will disenfranchise civil servants and their dependents from accessing healthcare services and is in contravention of a collective bargaining agreement signed upon by civil servants in 2011. And as Mary Mwoki reports, the medics argue that the law, if implemented as it is, will drive up the cost of accessing healthcare in the country.
Barely a month after the president assented to the Social Health Insurance Fund Act, the legislation is running into headwinds. Doctors, who will be a key determinant in its success, have come out to oppose its implementation, saying it is in breach of Article 43 of the Constitution and contrary to the 2011 Civil Servants Collective Bargaining Agreement. The KMPDU have taken issue with the transition clause, Section 5, which says on the appointed day, referring to the day it becomes operational, the fund shall not provide enhanced benefit schemes and packages. The medics say this in its entirety will disenfranchise over 500,000 civil servants and their dependents, amounting to over 3 million people.
It then means that the monetary deductions is going to increase threefold. That means if you are paying 1,700, you're going to pay 5,000. You won't be assured to access care in all the hospitals. And that's why we are saying this must change. There's a gross injustice and a breach of our duly signed collective bargaining agreements on the provisions of the comprehensive cover. The
KMPDU has also criticized the Parliamentary Health Committee for ignoring the proposals submitted by the union during public participation on the bill, saying the recommendations requested a transitional period of a year. The Doctors' Union has also taken issue with the clause requiring unsalaried Kenyans to pay their premiums for the whole year upfront, saying it places an unnecessary burden on unemployed Kenyans and those in the informal sector.
This particular Social Health Insurance Act will say a discriminations on the informal sector. And why we are saying this, that is in this bill that says that all the informal sector employees, those who are in the informal sector, who are not salaried, will have to contribute their premiums annually, upfront. The government doesn't trust its own people to make sure that they all pay even if they don't have.
The Social Health Insurance Fund will replace the National Health Insurance Fund, NHIF, once operationalized, and will see Kenyans deducted 2.7% of their salaries to fund it. Employers have opposed SHIF terming it as an added business expense that may lead to jobs and salary cuts.
Solidarity forever.
Mary Mwoki, Citizen TV.